This is a test-taking strategy tip with RN2 professors. In this video, I will define what a priority question is, show you how to identify it, and give you an example. Test-taking strategy helps you use everything in your arsenal to conquer the multiple choice question test. Whether it is an exam or boards, test-taking strategy is a skill used to analyze a test item before an answer is selected. Do not be tempted to select an option too quickly. An option may contain accurate information, but it may not be correct because it does not answer the question asked in the STEM. Be careful. Each option deserves equal consideration. What is a priority question? It is a question that requires you to put a value on each option and then place them in rank order. If the question asks what the nurse should do first, what the initial action by the nurse should be, or what the best response is, the option that you ranked number 1 is your answer. Identify the word in the STEM that sets a priority. Read the STEM carefully while looking for keywords such as first, initially, best, priority, safest, highest, support, and most. A tip to help you answer priority questions is to refer to basic theories and principles that you learned in nursing foundations, such as Maslow's hierarchy of needs, the nursing process, and the ABCs of prioritizing physical care, which are airway, breathing, and circulation. To choose the right principles or theory, you first have to identify what is happening and what should I do. Then decide which best applies in the scenario presented. You should keep these theories in mind when answering test questions while recognizing the following concepts. Physiological needs generally need to be met first before higher level needs. Disbelief and denial are generally a person's first responses to news of loss or anticipated loss. Meeting the needs of the client comes first over other tasks. Client readiness to learn must be assessed first before designing a teaching program. A client's emotional status must be assessed as part of the first step of the nursing process. Nurses need to use interviewing techniques to communicate effectively in a non-threatening way with clients. The nurse must deliver care in a non-judgmental manner. Maintaining a client's airway is always a priority. The client's safety is always a priority. A thorough assessment must be completed before other steps in the nursing process. Let's take a look at an example of a priority question. A nurse is caring for a client who just had a long leg cast applied for a compound fracture of the femur. Which is the most important nursing intervention when caring for this client? Number 1, turn in position every 4 hours. Number 2, take pulses proximal to the cast area. Number 3, cover rough edges of the cast with tape. Or number 4, inspect the cast for signs of drainage and bleeding. The keyword in the STEM that sets this as a priority question is most. To determine the most important options, use the ABCs, which are airway, breathing, and circulation. Notice that there are no options associated with airway or breathing. However, options 2 and 4 are associated with circulation. If you identify that assessing a distal, not a proximal pulse, is important, then you can eliminate option 2 and you've arrived at the correct answer. This is only one example of a strategy that will help you be more successful in test taking. Check out our Tuesday Tips series for more. If you found value in this video, make sure to subscribe and click the bell to get notified when new videos come out.